Hi, everybody. Welcome to week 5. So this week we're going to be talking about population health. It's like the holy grail of healthcare and what we're supposed to be doing. Those of us that are in clinical positions, administrative positions, we have really focused on shifting our attention to not just outcomes for the individual, but outcomes for the population as a whole. So a definition of population health is the health outcomes of a group of individuals, including the distribution of outcomes within the group. So this graphic, I think, is nice in kind of wrapping our heads around what exactly does that mean. So in the very center, you can see the circle area where we've got our physical and social environment as an individual, our individual cognition and behavior, our genetics and individual biology, which again, as we learned in that first week, all comprise what we consider predisposing factors for our health status. So in addition to recognizing that those are going to be different for every single person, we can start to see some commonalities across different populations and different groups of individuals within the community. So part of what population aims to do is down here, use science. We're seeing increasing opportunities to use predictive analytics to help understand exactly what markers we're seeing in different populations and what opportunities may exist then for some policy decisions or some education. These are what we consider our population health interventions. Once we understand at a large scale, looking at different populations within the communities that we serve and understanding what the challenges are with each one of those populations and how it pertains to different, usually chronic health outcomes, we can start then to think about what interventions might make the most sense. So again, going back to week 1, this is what we would largely consider our enabling factors. We are going to focus on cost, access, and all of the things that basically need to be in place in order for individuals to get the care that they need. And again, ideally that is happening in a preventative way, which again then should, in theory, result in better health outcomes and improved health status for, again, those that we serve. In addition to thinking about population health this week, I also want you to be aware of community health needs assessments. So these are basically initiatives that the health system has to go through on a periodic basis. For critical access hospitals, a community health needs assessment has to be done once every 3 years. It was mandated by the Affordable Care Act. And usually this is a process that is done not just with the health system and their leadership team and whatever sort of consultants they should decide to employ, but it's also really done in partnership with others in the community, the Department of Health, other nonprofit organizations that might be able to support specific populations. And so these community health needs assessments are, again, really kind of fundamental and critical to population health, how we're thinking about that analysis of the data and understanding those opportunities, but also then helping us make data-driven decisions about which population health interventions might make the most sense. And again, we should always be thinking about this in terms of using the scientific method, because we might try interventions that don't work and that don't move the needle for us, and that's okay. We just need to keep in mind this kind of notion of continuous improvement, the growth mindset, and that if one, kind of approach that we take fails, then we've learned something. It is not a waste of time and energy, as long as we can document what actually happened and what we're going to then do as a result. Again, that's kind of what we call validated learning that will help propel us forward. So when we're thinking about these community health needs assessments, typically they're done again with stakeholders throughout the communities. Usually there are focus groups that are employed, surveys that go out to the community. And again, depending on the people that you're working with, those surveys, electronic via email may work for some, but certainly that might not work for others. So, making sure that you are getting a good solid representation for all of those kind of key voices within the community and understanding kind of which groups and categories and populations they kind of fit into. Once you get that feedback, in addition to doing interviews with community leaders and also looking at your utilization metrics, both on the inpatient and outpatient side, you can start to put together a picture and really tell a story about what is this, this group of individuals, where are they struggling and what do they need? And again, that should help guide our population health interventions. So I'll send this out in this the update this week, but I'm going to be including Johns Hopkins for their All Children's Hospital, their 2019 Community Health Needs Assessment, which is really straightforward. It's only 9 pages. It is written for a very broad audience for anybody to anybody should be able to pick it up and look at it and understand it. And in this case, you can kind of see the methodology that they used over here on the right-hand side. So they, again, kind of did some surveys and focus groups and had in total over 1,800 participants that are representative, again, of these different voices from within the community. And through that approach and through analyzing the data, identified 6 priority health issues for children, which in this case were asthma, allergies, infant mortality, exercise, injury prevention, mental health, and substance use. And their top barriers include no health insurance, access to providers, no access to behavioral health, and no transportation. So for many of you that are working in acute care facilities, or even doing things on the outpatient side in behavioral mental health, you are probably seeing these same issues. They're also seeing limited access to nutrition and other physical activity, limited healthy living education, and a kind of a poor distribution of resources. So we're probably going to see commonalities, as we look at this report and use it as an example. But what I would like for you to do is to go back to your organization and find your last community health needs assessment. If you can't find it yourself, ask where it is. And then I would be very, very interested to know what kind of resources were used to address some of these issues and where do they stand and what is the data, right? Again, as we've already been working through just the first few weeks in the semester, we want to use data and facts to support our position on a topic and be open to the fact that our kind of assumptions going into something may be challenged, and being open to the fact that we might uncover something different that we didn't expect. But again, one of the challenges that we see is with a lot of these initiatives is that they just kind of fall to the wayside, and we don't want to see that happen. So health equity along these lines is a term that we hear a lot, and health equity, and this is the CDC's kind of definition or explanation of what health equity is. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Health inequities are reflected in differences of length of life, quality of life, rates of disease, disability, and death, severity of disease, and access to treatment. So again, we know that some of us, kind of because of a lot of the different factors, are social determinants of health, can do a better job of living what we would consider high quality, long life, and having access to the care that we need. Not everybody can say the same. And so a part of our purpose, primarily, as many of us are working at not-for-profit institutions, is to provide care to the communities that we serve. And it means that we are not just providing care and access and treatment and receiving, awesome health outcomes just for this kind of upper echelon that has access, can pay for the care. But we need to make sure that we are also looking to those that are more vulnerable and creating opportunities and pathways for them to live, also very long and fulfilling and high quality lives. So just this week, for those of you, again, I know last week I had kind of put out and suggested that you follow Becker Health Hospital Review, as well as Modern Healthcare AM. This was just in an email that came out, I can't remember if it was last night or this morning, but the Loan Institute Hospitals Index reports just came out. So the Loan Institute basically evaluates all hospitals throughout the nation to look and give them a grade on their overall social responsibility. And out of the more than 3,000 hospitals, only 75 earned an A grade for equity, value, and outcomes, which are the 3 metrics used to determine overall social responsibility by the Institute. We see that hospitals with top clinical outcomes often don't score well in equity metrics, and none of the 20 US News and World Report best hospitals made the Loan Honor Roll. So again, go and check out this report, scrape through and see what you can find in New York State. Unfortunately, we are not well represented here, but that is where we all have an opportunity to change the course of this and to be thinking about population health, how we are analyzing the needs of those that we serve, how we're actually creating plans to go through and implement and make some changes based on those findings. So I will also be including in the announcement that goes out today, an article that came out that suggests that unfortunately, for many not-for-profit hospitals that have to go through and do this community needs assessment, is that it's almost become, a checking of the box, as many things do that are required. And they found that of all of the community needs health assessment reports that came out, and I believe this was over the course of the past year, 15% of them, you couldn't even find the community report. 25% of them did not have resources to kind of to follow through on their plans for implementation and to address some of the gaps that they saw. So we know that we've got a long ways to go in really using these community needs assessments, doing a good job, in collecting the data and visually displaying it and making it easily digestible for everybody in our community. But more importantly, then taking specific actions to try to close those gaps and using the scientific method to go through and walk through those opportunities, knowing that not everything we try is going to be successful, but being transparent with what works and what doesn't so that others can learn from us. As always, if you have any questions this week or at any point throughout the semester, please send me an email.